As the toll from coronavirus continues to escalate, physicians and scientists are asking many questions as the data comes in. Why are there so many asymptomatic carriers? Why do so many healthy appearing people, often members of the same family, get so badly affected? And why are certain countries and regions faring worse than others? My name is Dr. Suneel Dhand, and here are 5 huge risk factors for getting very sick from coronavirus. Number 1 is age. The risk of becoming seriously ill, that is going into respiratory failure and requiring a ventilator, increases exponentially with age. Some data is suggesting a staggering 10 to 30% mortality rate in people over the age of 85. Despite some really sad stories you're hearing on the news about younger people, about children who have got very sick with coronavirus, the overall risk remains low. Number 2 is anyone with chronic disease. Anyone who has illnesses, particularly those that affect the heart or lungs, or anyone who is immunosuppressed needs to be extra careful. This can occur at any age. It could be the 75-year-old with heart disease and COPD, or it could be the 22-year-old who's on immunosuppression because of Crohn's disease. Number 3, smoking. In almost every country so far, smokers have fared worse than non-smokers. Smoking, of course, damages the lungs. That has been the focus of public health campaigns for decades. Yet another reason to stop smoking if you do, because unfortunately this virus looks set to be with us for some time. Number 4 is being overweight or obese. We know that these put you at risk of other chronic comorbidities, but initial data is suggesting from ICUs that a disproportionate number of patients ventilated are overweight or obese. Number 5, male sex. This has been observed in many countries. In fact, some data from Italy suggested a staggering 70% of all deaths have been male. Now, there could be many confounding factors, but prior research has also shown that females naturally and genetically have a stronger immune system, especially to any new foreign threat, compared to men. Many theories as well behind this. It could also be an evolutionary survival advantage for any species. So there you go, 5 massive risk factors for getting very sick from coronavirus. Some of them are more in our control, like smoking and obesity. Others, such as age and sex, are not. These are really important because as this whole situation progresses and evolves, we need to shape public health policy to target the particular at-risk, most vulnerable groups.